The barriers to mental health, healthcare access are significant ones facing many, many Americans. More than half of adults with mental illness in the U.S. do not receive mental health care treatment. And that statistic alone is cause for concern. But mental health issues are far more common than people realize. And to discuss the ways we can improve treatment, please welcome Deborah DeSanzo, Amy Powell, and Bernard Tyson with my co-chair extraordinaire, Arianna Huffington.
So we have an amazing panel to discuss what has become the leading cause of disability worldwide. And it's only getting worse. Basically, 350 million people worldwide suffer from depression. And in the past 45 years, suicides have increased 60% worldwide. And every day, the opioid epidemic is getting worse. And yet, we continue treating mental health, with a few exceptions that Bernard is going to talk about, as though it is not somehow part of the overall health, as though it's somewhere in the corner by itself. So to discuss what we can do differently, we have Bernard Kaiser, who is, of course, the... Sorry. You know, I always call him Bernard Kaiser. That would be a good name for him, but you don't have to change it. Bernard Tyson is fine. And he has not only been leading the discussion about mental health, but as chairman and CEO of Kaiser Permanente, he's already leading the way in putting this new way of thinking into practice. And that's not just for the benefit of the over 12 million members of Kaiser, but for the benefit of all of us by setting a new pathway to treating healthcare, mental health care differently. And Deborah, who is, of course, also our major sponsor here for the conference. Thank you so much, Deborah. And the general manager of IBM Watson, working on the moonshot of changing how we provide global health care. And at the same time, she's taking care of her own mental health by meditating and being, I think, the only black belt on the panel, right?
I don't know.
Unless anybody wants to challenge that. And I'm really so happy to have here for the first time at this conference Amy Powell, the president of Paramount Television and Digital Entertainment. Among many other things, Amy produced 13 Reasons Why, which was the groundbreaking Netflix series that fueled a nationwide discussion about teen suicide and mental health. And so one of the things we want to talk about is how can we change culture in order to treat mental health differently. So let me start with you, Deborah. This past year, a lot of the discussion has been about the ways technology impacts our physical and mental health, both in all the positive ways that we have discussed, but also in the negative ways. We have the data, for example, now that teenagers who spend 3 hours or more on social media have a greater chance of depression or anxiety. So what do you think about this inflection point we're in, where as well as celebrating what technology makes possible, we are becoming much more aware of the unintended consequences?
I think it's from a tech company, so I have a point of view, and we absolutely need to watch social media and the effect that it has on our teens. I'm going to go to the other end of it, though, because it can also very much help. So in Bolzano, Italy, has more people over the age of 60 than any other city in the world, Bolzano, Italy. And of course, because of this, their healthcare costs are rising. And in Italy, the government pays for healthcare, so they have to be careful about their healthcare costs. And what they found in the aging population is that the elders are lonely. And of course, then loneliness leads to other more complicated diseases, leads to mental health issues. We've actually been able to use social media, connecting the elders together, and a community also connecting them together with their children, and using these cool Internet of Things that by unobtrusively watching, you know, did the mother get up and cook her pasta, and it's Italy, so it really is pasta, and watching what's going on, we can see patterns in what's happening. We can create alerts if something is off from where it is. But what the elders have found mostly is that by connecting them to their children that might live in another city or somewhere else, that they're rising out of there, they're feeling more connected. So it's absolutely, we have to watch the effect of social media on our children, but not throw everything out, because we see just terrific places where technology can help.
Absolutely. So Amy, since you've worked on specifically the impact on teenagers, is there something different about the impact on young people before they have actually built their own foundation, their own moral compass, their own sense of what matters?
So we produced the show 13 Reasons Why with Selena Gomez, who actually bought the book with her mother when she was about 19 years old. And they bought the book together because Selena was so aware of teenagers' pervasive senses of loneliness, of self-criticism, of bullying vis-a-vis social media. And I don't know how many of you have seen the series, but it sort of attacks head-on teen suicide as a result of online social bullying, where our lead has a photo shared of her in a compromised position and takes her life by the end of the series. And we decided to really show that scene in graphic detail, to much controversy, I will admit, but really to spark a conversation not only amongst teenagers, but with teenagers and their parents. Because one of the things that we saw kind of in contrast to this example here is that kids and their parents weren't connecting about this provocative topic, and they felt isolated from each other on both halves of the equation. So we kind of struck right into the heart of the zeitgeist and right into the heart of the controversy to say to parents and kids, talk to each other, talk to somebody, because we wanted kids to realize that their life is so much bigger than this one moment that they were experiencing vis-a-vis social media, and that no one's life was worth taking.
Bernard, you've written that the healthcare industry needs to take a unified approach to mental health, with the understanding that the mind and the body are irrefutably connected. So how have you put that into action at Kaiser?
In terms of context, what I've been talking a lot about is, if you stop and think about it, we have disconnected the head from the body in how we take care of mental health illnesses. So we have people to go to a different room in the industry, separate records. We treat it all differently. Some of that came as a result of the negative stigma of mental health itself. And so most of us have it, or 1 degree from it. It's around us, but nobody wants to talk about it. So we've been working on a multi-pronged approach. One is to deal with the stigma issue, and we call that Find Your Words, and it's right in line with what you're talking about, is showing people that there's a way to just ask for help and or just say, I have a problem. We're gathering more research and data, and you certainly have talked about data, and I really resonated with what you're talking about. The #1 killer for girls right now between the ages of 15 and 19 is suicide. The number 2 killer for young people between the age of 15 and 29 is suicide. 50%, roughly 50% of people who commit suicide never shows any sign to someone that they are thinking about suicide. It's a bad problem. So we've been working to now integrate with inside of our system to integrate psychiatry and behavioral health services inside of the primary care practice. And it's ironic that, especially in our situation, we can do it readily because we've always worked with a team-based integrated model. And so now just think about if you come in to see Kaiser Permanente physician, one of our Permanente physicians, and you have a knee pain, it's not unusual for the doctor to say, you know, Dr. Sally is down the hall. She's an orthopedic specialist. I'd like her to come in and take a look at this. And 9 out of 10 times the patient says, I would love that. So now you're sitting in the doctor's office and they ask you, how you sleep? How are you sleeping? I'm not sleeping well. How are you eating? I'm not eating well. Do you have a lot of stuff on your mind? Yes, I do. Do you feel stressed? All the time. So I have Dr. Sally down the hall. She's a behavioral health specialist. Why don't you let us come in and do an assessment, see where we go from here? So you build it as an integrated part of the whole practice, and you start to orientate people that the mental illness is something going on in the brain. And you start to treat the brain as an organ, which it is, just like you would a heart. And it's our hope that sooner or later we will start talking about mental health as easily as we talk about diabetes and cancer, all towards making it okay to say, I'm not okay today. And that's really what people are dealing with, the complexities of life that causes anxiety, that causes depression. It can happen to any one of us at any given time. And it's devastating not only to the individual, but also to the extended family. And so we're taking a holistic approach of how we address this, just like we have every other kind of disease that we've dealt with.
Deborah, Bernard mentioned how this is like a disease of the brain. You can measure some of the impact of what all these social determinants are having. You know, some of the things that Bernard mentioned, like sleep, like what people are eating, like how much stress are they under. That's an enormous amount of data to bring together. So how can technology help us bring all that information together in a way that becomes actionable and that can lead to behavior change?
I loved what Bernard said, where he said we're an integrated system, so we can ask these questions and send the patient down the hall. And it's not always like that. So when what we see, so we do health and human services in 22 countries, so 170 million people, and 20% of the population will have some type of behavioral health issue, but they're accounting for 80% of the cost. And we know that if we don't get behavioral health under control, then you can't get your diabetes under control, or you can't get your heart disease under control, you can't get anything under control. So how technology can help is exactly that. When Bernard went through the questions that he was asking, you know, how are you sleeping, how's your stress level, sometimes that is not, it does not come to the surface of the electronic health record, or it doesn't come to the surface of, it might be in a doctor's note, or it might be somewhere else. And so what big data can do, what technology can do, is actually mine through all the information. Electronic health records now are thousands and thousands of pages long. What we can do is mine through all that, not only the electronic health record, but work records, other records, court records, mine through it, bring the important information to the surface so the primary care physician can see it, or someone can see it and then address it. Sometimes the data is simply there. It's there, but it's invisible. And what technology can do is help make the invisible data visible, so then you can act on it.
And then it's really the combination of data and then storytelling that can help engage people emotionally so they can do something about it. And Amy, that's where you come in. Is there anything more that can be done? And maybe you already did a lot of that to build like touch points that can touch consumers and those watching the series and help them make changes in their lives?
Yeah, it's interesting. On the first season of 13 Reasons Why, we went to Netflix and said, we're really worried that when kids are watching this show, they're not going to have an interactive resource to click a button or to automatically call somebody because you're on a platform that doesn't have that level of interactivity, of course. And they agreed, but we didn't find a solution. So we taped what we called a town hall, and we partnered with a lot of different crisis text lines to provide resources to people who were viewing. But it wasn't an immediate click. I'm watching this, I'm worried, I'm gonna hit a button and someone's gonna call me back. And those are things, we just finished season 2, we're starting season 3 now, that we've worked with Netflix to improve for the first time on their platform. The ability for users who are watching the content to have an immediate response. We've geo-filtered all of the DMAs of where these viewers are watching to be able to say, we know where you are at, and we are actually going to find somebody who's on a phone in your zip code, essentially, as much as we can be specific about that, to call you back immediately. So we're really trying to create a connective one-on-one dialogue between somebody who's having a crisis of whatever level that might be and somebody who's resourceful to be able to help them immediately. And that feels like our responsibility as storytellers, and also it's important to the people who created the show and the network that's distributing it, that we're responsible in our content creation.
Right after this question that I have for Bernard, I'm going to come to you, so I hope you are ready with your questions to the panelists. Bernard, I wanted to ask you, you have been such a pioneer on this. I mean, I remember doing an entire panel with you in Davos early on, before people were talking a lot about mental health. How have you seen the stigma associated with mental health change? Are we much more willing, when I say we, both us individually as well as corporations, to address it openly?
I am seeing a shift, and I think it's a combination of everything that's going on, the impact of social media. Storytelling is very important. I think that we're not there yet, but I think people are more sensitive to that this is an issue that we have to deal with. I think in some cases it's mischaracterized when we have these kind of events that are unfortunate. And so I think there's still work to be done on how to define mental health, and it's not every time you have a particular kind of shootout and those kind of things. You know, in fact, I shared last week, I was curious inside of Kaiser Permanente, how many gunshot victims did we take care of? And so 2 weeks ago, I asked somebody to pull those numbers for me right quick. And for 2015 and 2016, we took care of 11,285 gunshot victims just in our system. And not all of those were mental health issues. They were probably domestic issues. Somebody got upset in the moment, so heat of the moment. I think as we continue to talk about it, though, our work is to create the right framework. Number one, where it's okay to talk about it. I mean, just think about historically how we dealt with mental health. We called people crazy and nuts and psycho and all of this, and we created this negative image around it. And then if you fast forward to today, all of us are dealing with extraordinary stresses in life. And part of our work ahead of us is new tools for resilience and how people deal with the realities that we are in a fast-paced society. The world is moving very fast. The news is changing every 5 minutes. Well, now every 1 minute. And there's a lot going on. And helping people to cope with all of this. And then you have this tool called the iPhone now, or the iPad, or whatever tool you're using, that the research is starting to show that people are on it almost 24/7. You wake up at night, you got to get on it. And I mean, you're trying to teach us different ways of unplugging. You tell us to put the phone in another room. Then we move into that other room. But we're making progress. And so, you know, we live in this kind of society now, and we need to, in the 21st century, continue to think about a holistic approach to the realities of how we live in today's society.
It's really establishing new rules of the road. I mean, if you think of it, the iPhone is only 10 years old. So we're just beginning to be very conscious of all the problems that were unintended, but here they are. We're seeing them and we have the data. So, questions? Yes. And
Good afternoon. I'm Erin Byrne, the CEO of Gray Health Group, and I absolutely agree we need to change the conversation about mental health, really moving from the I in illness to mental wellness, with we being a community that supports the person in their quest for mental wellness. But what specifically can we do about stigma? Because all the resources we provide, if they don't feel comfortable taking that next step and they're afraid not only of the implications for themselves but their family and this younger audience, nothing will change. So I'd really be interested very specifically in what you think we should be doing to avoid stigma and change it.
You know, one of our ecosystem partners is a company called Teatros. They're actually in San Francisco. And they work with veterans, and so one of the stigmas on veterans is their mental health when they come back. And actually, again, to the opposite, and I don't know if there's an age thing, but what Teatros has done is they have created a social media platform to have veterans talk together. So there's much less stigma there. So you're in a community together, connecting veterans to veterans. They talk about their problems together. We use Watson Personality Insights and Tone Analyzer also to watch the conversations, watch the tones. We can identify personality traits, needs, and values. And then Teatros is not only creating the social platform, but also personalized cognitive behavior, treatment plans for the veterans, and it's helping tremendously. So I think you get patients like me together or people like me together, and you can use technology for the good, use a social platform for a supportive, and this is what Teatros has done.
I think just to build on that, we're targeting large companies because you have a lot of issues with mental health in the workforce, and so I think figuring out how to get large groups, but I also think this whole thing about being willing to talk about it and continue to promote the openness of the discussion continues, I think, to be a very effective way.
Yes. Yes.
Craig Lefay, the lead change designer at RTI International. I've been spending a lot of time with stigma as well, both with Special Operations Command, where suicide is probably the #1 issue that those troops are dealing with these days and their commanders are dealing with these days. And one of the things that I have noticed in my work with them is not just the issue of the individual stigma, and there was also the reference to the stigma that gets reflected onto the family. But because you're in the Department of Defense, you can also look at, well, what are the policies that are in place, or the institutional stigma that goes along with this? And the one study that was done just a couple years ago identified over 200 policies that in one way or another stigmatize soldiers who have some kind of behavioral health or mental health problem. The interesting thing of all that, however, was that part of the problem with the institutional stigma is no one can really define that very clearly. They talk a lot about stigma and anti-stigma efforts in the Department of Defense, but you very rarely see a definition of what they mean by those types of things. So I'm wondering what your response is to the idea of what's the institutional drivers, or the social determinants, if you like, drivers of stigma, and how do we kind of move this conversation not just from the individual and the people around them, but kind of to more the upstream drivers of some of these problems?
You know, I don't have the answer to that question, but I just want to acknowledge that's a great question. It's in our school systems as another example. It's how we deal with what we call learning deficiencies in our society. And his point is an excellent one, and it gets back to this whole thing about definitions being needed in today's time, because no one really describes what it means, but all of a sudden somebody is saying, but this is it. And unfortunately, what's happening now with the stigma, you get labeled. And that's what we're trying to address, which is the labeling of this. And the labeling of mental health is still seen as a very negative thing. And I love also the mental wellness. I have a dear friend that keeps telling me I should be talking about brain health, but I'm still talking about mental health and wellness, but the point is it creates a different kind of dialogue, and that's what we need to do to begin to put those kind of definitions around this complicated topic.
Thank you so much. Thank you, Deborah, Amy, Bernard. And this is a conversation we want to continue with you through the months and years ahead. Thank you.
Thank you.
Thank you.